So today we're going to talk about minimizing the skin side effects of our patients that come to us for radiation therapy. We get a lot of breast cancer patients, head and neck patients too, that end up having skin side effects. But today I'm going to mostly focus on our breast cancer patients. One of the first questions that a lot of patients ask me is, will the radiation burn them up? And since you don't really know exactly how a patient's skin will react to the radiation, we just try to assure them that we're going to do everything possible to try to prevent and minimize those skin side effects. So radiation therapy is high energy radiation that is used to kill cancer cells. It can be damaging to the skin. And we want to try to minimize those skin effects by giving our patients topical agents to reduce the redness and any type of desquamation that the patient may experience while going through radiation. And about 90% of patients that are treated with radiation, about 90% of those patients have skin side effects. So it's very important that we try to get a hold on that. This is just a couple pictures of how women have to be positioned while they're being treated for radiation therapy. Breast cancer, of course, is cancer that develops in the breast. Malignant tumors can invade other tissues. That's what makes it malignant, because they have that capability to invade other tissues. Some of the symptoms that women can experience is a rash around the nipple. They may notice a dimple in the breast, pain in the armpit. Matter of fact, we had a patient recently, probably about 3 weeks ago, come in, and she was just so happy that it was even found, because her lump was found really, really high up in the armpit. Men can develop breast cancer as well, but it's really rare, and it only accounts for about 1% of all cancers. This just shows areas of breast cancer development, like I just pointed out. You can see how high up breast cancer can develop. Around the nipple, up under the breast, on the side of the breast. So radiation in the skin. What happens is, while the patient is going through radiation, the skin is being damaged. But the skin is trying to repopulate healthy cells at the same time. An inflammatory reaction will occur, possibly, and this is a natural, normal physiological effect of radiation. So as the patient continues to receive radiation, the skin is going to possibly be further damaged as the skin continues and the body continues to try to bring on and grow healthy new cells. But often the body cannot grow those healthy new cells and develop those healthy new cells at a rate faster than the old cells are being shed, and the scalp can become dry and flaky. Again, as radiation continues, the skin, you may also notice on the skin moist desquamation. The skin can be broken. So this is how we grade the skin effects. Grade 0, of course, normal. Normal, healthy skin, you wouldn't see any changes. Grade 2, grade 1, you'll see redness. A slight amount of redness for grade 1. Grade 2, you're going to start to see a lot more redness. That's probably most of the time going to be confined to the breasts and the folds and the creases in the breast. Grade 3, moist desquamation occurs. The skin is broken. Any traumatic incident to the skin, it can bleed. Grade 4, you'll see necrosis. So skin toxicity, of course, remains a very important issue, clinical issue, while our patients are being treated for radiation. The severity of toxicity can be related to several different factors. You have to, of course, take into, first of all, what type of health condition the patient comes in, any other health-related illnesses that the patient may present with as well. total dose per fraction, the location that we're going to be treating, the volume of the treatment being the volume of the area being treated also has to be taken into consideration. So again, some of those temporary skin side effects could be just mild redness to brisk moist desquamation. And presently, there's not anything specifically that we can do, or clinically, a clinical guideline that we can use to prevent or minimize skin side effects. So this just shows a lot of our patients, when they come and they begin the course of radiation therapy and they begin to experience some of those side effects with the skin, it really, really hurts. And that's their thing. Look, my skin is really hurting. Sometimes the skin burns and they're like, what can I do to fix this? And we've actually had several patients that wanted to quit because the pain was just that great for them. So the current agents, the current things that we use to treat our patient's skin, we use aloe, we use a cream called Mioderm, we use Aquaphor and melatonin. Those are the main creams that we suggest for our patients. And we encourage them to use it about 2 to 3 times daily. So I found a study from January 2011 to December 2011 using 100 female patients all diagnosed with breast cancer. These patients included, they had conservative surgery, margins were free of disease, and they were candidates for adjuvant therapy. The dose was 50 gray to the whole breast and an additional dose of 10 gray to the tumor bed. The topical agents that they prescribed for this study were broken down in 5 groups. Again, the patients were told to use the creams 2 to 3 times a day, 3 hours before treatment and 3 hours after treatment. They started treatment 15 days before they even began their radiation therapy, which is something that we have not implemented here, but may be a good idea for us to start, because the whole key is for the patient's skin to remain hydrated. They also used the creams for 1 month until the end of treatment. And they could not use any other creams while they were in this study and going through the radiation and using those particular creams. So for group A, of the 20 patients, 18 showed G1 toxicity and 2 showed G2 toxicity. All of the patients had a good grade of hydration, which is so important, as I learned with this study and as we even see here in our patients. Keeping that skin hydrated is really key. Group B of the 20, 16 showed G1 toxicity and 4 G2 toxicity. Again, measurements showed value of moisture with slight decrease during therapy and first follow-up. Now, I want everybody to keep in mind that depending on the severity of the skin side effects, of course, is going to determine how that person's skin would look on their first follow-up. Group C of the 19 patients, these manifested G1 and G2 toxicity at the end of radiotherapy. But the alga Atlantic played a central role in protecting the skin's integrity. Group D, 20, 7 had G1 toxicity, 8 a G2, and 5 a G3. 8 of the patients who suffered cutaneous toxicity during treatment also showed a G1 at the first follow-up. So again, just depends on how that patient went through the course of radiation and how their skin did is, of course, again, how they're going to show and present on that first follow-up. The last group of the 20 patients, 15 had G1, 5 G2 toxicity. Selectios played a role in inflammatory reaction, whereas the avenue thermal water and glycine modulate with itch and reddening. So the end result of this is that prevention is the best. Hydration is what we have to encourage and try to teach our patients to do to minimize and possibly even prevent skin toxicity from radiation. In this study, corneometry was used, which is the water content of the skin. Again, this is important because if the skin is dry, it becomes less elastic than moisturized skin. Drier skin is more at risk for damage than moisturized skin. So, of course, the most important thing that we can do is to try to have our patients end up with positive, even greater positive patient outcomes. That's always our goal. And I think one of the biggest things that I learned while doing this project is that possibly we can implement some new ideas about hydration and really encouraging our patients to do that. Are there any questions? No? Okay, thank you.